confirmed number of cases here in Alberta has risen by 17 in the last 24 hours to a total of 56. Of the 17 cases, 3 are in Edmonton and 14 in Calgary. Chief Medical Officer Dr. Hinshaw will follow with details on these cases. We believe we have reached an inflection point in the progression of this pandemic in Alberta. For at least some of the new cases over the weekend, public health officials have not confirmed a travel history or close contact with a traveler. This indicates community spread. However, follow-up investigations are continuing. It is very important to emphasize that here in Alberta and around the world, international travel is the key element of transmission. Albertans returning to home from abroad or foreign nationals coming to Alberta are critical. It is critical that they respect the advice being given by the Government of Alberta. Visitors must be vigilant for symptoms and must immediately self-isolate for 14 days. Frankly, from today onwards, all non-essential travel plans should be cancelled. And let me be clear about that. I still hear about people planning to take spring break outside of the country. If they do so, they may have difficulty getting back into Canada because of the cancellation of flights. And if they do come back, they will be required to self-isolate for 14 days. There is no good reason to be traveling for leisure purposes at this time. I have asked Travel Alberta, in fact, to redirect all of their advertising to informing Canadians who are, for example, snowbirds in overseas locations about the protocols for their return to Alberta to help us manage the COVID-19 response. I want to remind people that seniors and those with compromised immune systems are the ones with the highest risk. So just because you don't feel at risk yourself doesn't matter. We're all responsible for each other's health at this time. I am concerned by reports of inadequate screening and information for people arriving from international flights at our airports, and I will be raising those concerns directly with the Government of Canada. The Emergency Management Committee of Cabinet met earlier today. In response to the escalating number of infections, Dr. Hinshaw and her team have recommended new measures on social distancing to contain the spread of the virus, and the government has accepted those recommendations. These include the immediate cancellation of all K-12 and post-secondary classes, as well as closure of licensed childcare and out-of-school care programs in Alberta. More restrictions may be rolled out over coming days as officials' advice evolves in response to the identification of new cases, so please keep checking for the latest public health directives online at alberta.ca. And please continue to take all basic health precautions. Wash your hands thoroughly with soap for at least 20 seconds, do so regularly, and always before touching your face. Above all, take care not to expose the elderly or immunocompromised individuals if you have any symptoms of sickness. Minister LaGrange and Dr. Hinshaw will have more to say on the cancellation of classes and the closure of daycares. I am also announcing today that the Government of Alberta will increase the health budget by at least $500 million to cope with the COVID crisis. This is in addition to our already budgeted amount of $20.6 billion for Alberta Health, which is the highest amount in the province's history. This additional $500 million will be a recommendation of the government for an appropriation to the legislature this week. And we will continue to provide all of the resources necessary to help our public health officials cope with this crisis. Under the leadership of Deputy Minister Paul Winnick, the Provincial Operations Centre has moved to level 3 of emergency preparedness and has increased staff and resources accordingly. For those who don't know Paul, he is a former Lieutenant General, Commander of the Canadian Army, and Vice Chief of Defence Staff, who recently joined the Government of Alberta. We're fortunate to have somebody of his depth and experience at this time. In consultation with Paul and senior public health and safety experts, we are assessing all future actions that should be taken to protect Albertans. Once again, I want to assure Albertans that the Government of Alberta is totally focused on dealing with this crisis right across the board, all departments and agencies. And we are having excellent cooperation with municipal governments. Last night I chaired a teleconference together with Dr. Hinshaw and Health Deputy Minister Rosen with Indigenous leaders across the province, and we're impressed by their level of preparedness for the pandemic. We have full confidence in our public health and safety officials, and we're working together to do everything in our power to contain the outbreak and to keep Albertans safe and healthy. We are equally dedicated to managing the very serious economic consequences of the pandemic and the coincident global crash in energy prices. It is critical to keep businesses operating at this time wherever possible, for as long as it does not compromise, public health and maintain income support for workers. I'll have more to say about that in the legislature tomorrow. Decisions and actions taken now will ensure that our economy recovers as quickly as possible after the health crisis ends. We will move fast and we will move first, if necessary, to stop the spread of this virus and to keep Albertans safe. So now I'll ask Lieutenant General Winnick to speak about our emergency preparedness, and then Dr. Hinshaw will provide a full update on COVID-19 in Alberta and explain the rationale for cancelling classes and childcare facilities. And then Minister of Education LaGrange will provide further information about the balance of the school year. General Winnick.
Thank you, Premier. Good afternoon. I'm Paul Winnick, the Deputy Minister of Municipal Affairs. The Government of Alberta is taking COVID-19 very seriously, as the Premier mentioned, and we've been preparing our response since it was first identified in January. Since that time, we've been carrying out extensive cross-government coordinated efforts in order to remain fully prepared. Yesterday, our Provincial Operations Centre here in Edmonton elevated from Level 2 to Level 3 out of a possible 4 levels. Level 3 means that we are further enhancing and strengthening our cross-government coordination so that we can respond to rapidly changing situations. The Alberta Emergency Management Agency, which runs our Provincial Operations Centre, works with our partners to ensure that we can continue to respond to this ever-changing situation. Daily reports are distributed from the Provincial Operations Centre to all key partners, including federal departments, our own municipalities, and various other agencies across the province, to ensure that there is a common level of real-time situational awareness. We are constantly updating and reviewing our pandemic plan, as well as the Government of Alberta Business Continuity Plan, to ensure that measures are in place to maintain essential services to Albertans. As you are aware, Alberta has been through significant emergencies and disasters in recent years, including major fires and floods. Rest assured, because of these experiences, we are now able to work seamlessly with our key partners across the province and across ministries to respond to this evolving pandemic. Thank you.
Dr. Gina Hinshaw will now give an update on the current cases of COVID-19.
Thank you, and thank you all for coming. As the Premier noted, I have recommended that aggressive new public health measures be implemented across the province. Here in Alberta, we have confirmed 17 new cases of COVID-19 in the last 24 hours. This means that 56 cases have now been identified in our province. 2 of the individuals are receiving treatment in hospital and are in stable condition. The other 15 cases are self-isolating at home and are expected to make a full recovery. As always, health officials have taken swift action to isolate these individuals and any close contacts who might be at risk. However, there are several concerning elements about these new cases. Our investigation determined that 7 of these cases stem from a single gathering that took place in Calgary Zone. This underlines the fact that gatherings can accelerate spread of the virus. In addition, at least 2 of the cases within the last 2 days appear to have been acquired from an unknown source. This means we are likely seeing community transmission in Alberta. Community transmission is when a person catches the virus from someone who stayed in the province and not from someone who recently traveled. Until now, all cases in Alberta had been travel-related or close contact with a returning traveller. These two cases mean that there are other cases in the community that we have not identified, increasing the likelihood that Albertans may be exposed within their communities. In addition, another development over the past 2 days has been conversations that I have been invited to participate in with school leaders from across the province. I have heard clearly from them that the guidance provided by Health is proving extremely difficult to put into practice at the front lines due to product shortages, challenges with staffing, and other operational issues. I have repeatedly said that we will monitor the situation, assess the emerging evidence, and make decisions accordingly. Based on what we've seen over the last 2 days, it is clear to me that now is the time for additional action. We need to put in place more restrictions to help slow the virus and protect public health. That is why, effective immediately, the Emergency Management Cabinet Committee has approved my recommendation that students no longer attend classes in schools or post-secondary institutions until further notice. All regularly scheduled classes are cancelled, regardless of class size. We are also asking all licensed childcare facilities and out-of-school care programs to close immediately. Approved day homes are exempt due to the small number of children they care for, but they are encouraged to use sanitation practices and the guidance that we released late last week. As a parent with children in the school system and in after-school care programs, I recognize that this is extremely disruptive for many families and for those working in these sectors. This is not a decision that we are making lightly. I made this recommendation after extensive discussion with school boards and in consideration of the cases of community transmission that were identified over the weekend. To be clear, we are not closing schools. Teachers and other school staff should continue to come to their schools to plan potential alternatives for students, particularly those in grade 12. I ask parents to keep their children from gathering in large groups, as the purpose of this recommendation is to prevent the spread of the virus. I know that many parents, childcare workers, and teachers will have a lot of questions. This decision was made only a few hours ago, so many details are being confirmed. We will provide answers and make sure that Albertans get the information they need. Also effective today, we are recommending new restrictions for all long-term care facilities and continuing care facilities. I am advising that these facilities limit visits to only essential visitors at this time. Seniors and people with pre-existing health conditions are the most at risk from COVID-19. Special precautions must be taken to ensure that there is not virus spread amongst these groups. I know that families want to visit their loved ones. This step is not taken lightly, but is essential to protect the lives of the most vulnerable Albertans. I'm encouraging families and friends of those in these facilities to think of other ways besides visiting that they can support and encourage their loved ones through this difficult time. Finally, while last week I announced that places of worship were exempt from the restrictions on mass gatherings, that recommendation is changing. The exemption last week was done to try to minimize the impact of these restrictions on the daily lives of Albertans and in the context of having only travel-related cases in the province. However, as I mentioned earlier, that has changed, and we now have evidence that community transmission is occurring. Effective immediately, all places of worship are now being asked to follow the same restrictions being placed on other gatherings in the province. All mass gatherings of 250 people or more should be cancelled. Any event that has more than 50 attendees and expects to have international participants, critical infrastructure staff, seniors, or other high-risk populations in large numbers should also be cancelled. Events that do not meet these criteria can proceed as long as risk mitigation is in place, such as enforcing distance of 1 to 2 meters between attendees, ensuring that ill attendees are not present, and using sanitizer stations. Religious communities are a source of strength and comfort, especially in difficult times such as these. I encourage religious leaders to work with their faith communities to determine how they can continue to support each other, but in ways that reduce the risk of infection spreading.
The confirmed number of cases here in Alberta has risen by 17 in the last 24 hours